Welcome to our short film about targeted lung health checks in the east of England. You may have heard about the Targeted Lung Health Check programme in the news. It's a national screening programme for lung cancer. We've been at the forefront of delivering it in the east of England, and it will roll out to cover everyone in the east of England over the next few years. We're looking to invite people who are between the ages of 55 and 74, who are smokers or ex-smokers, to have a targeted lung health check. There is more information about this on our website. So you've been invited for a targeted lung health check, and I suppose the next question is this for you? Is this what you want? If we've invited you for a targeted lung health check, then we think it's going to help you, and I'd really like you to come along for it. We're aiming to invite everyone who is between the ages of 55 to 74, who are smokers or have been smokers in the past. We're basing who we invite from GP records, so you need to be registered with a GP to get an invitation. The aim is that we'll invite people who have no symptoms from their lungs. If you have got symptoms from the lungs, a cough that's gone on for more than 3 weeks, more breathlessness, a cough that's changed, or coughing up blood, stop watching the video and make an appointment with your GP. So we invite you for a targeted lung health check. You should get a personal invitation for it. The first part is actually just an assessment, and that may be face-to-face or it may be a telephone assessment. During the assessment, you'll meet one of our expert team and they'll ask you a series of questions about your lung health. Based on that, we may be able to say, actually, everything seems all right at the moment and we don't need to do anything further. But for some people, we'll invite you to go on and have a CT scan. If we do invite you for a CT scan, it's because we think it will help you. If you have one, we'll contact you with the results. But actually, for most people, the CT scan will be normal. And hopefully after the lung health check, you'll have the confidence to go on and carry on with your life normally. Let me tell you about the CT scan. We use CT scans as part of the targeted lung health check for some people. The scan's really useful to me as a doctor because it gives us a really detailed picture of what's going on in someone's lungs. The scan itself uses X-rays to create the picture, but actually it's a really safe scan to have done. I find that sometimes people worry that the scan is really claustrophobic and that they're going to have to go in a small tunnel to have it done, but actually that's not the case with this type of scan. It's a painless scan. We don't need to give you an injection and we don't need to take your blood for it. So there are no needles involved. If you have the scan, you'll be met by one of our expert team and they'll take you through the process. But actually, for having the scan, you just need to lie on a couch and you'll go through the scanner and then you'll be allowed to leave and we'll contact you as soon as we have a result. What happens after the targeted lung health check? Well, once you've had your targeted lung health check, we'll let you know what's going on as soon as we can. And actually for most people, we'll be able to say that there are no concerns. And if that's the case, then we'll invite some people back after 2 years to go through the process again. The targeted lung health checks, we're looking for lung cancer. And so sometimes, unfortunately, we will find lung cancer. And if we're worried about what's going on your scan, we'll get in contact with you and we'll arrange for you to have more tests at your local hospital. Even then, you may not have a lung cancer, and it may be that those tests are reassuring. The purpose of lung cancer screening is to try and find early lung cancers because they're the lung cancers that we can cure. And so if you go through this process and we find an early lung cancer, I hope that we'll be able to cure it for you and let you get on with the rest of your life. In some people, there won't be any concerns about a cancer, but we may still have some suggestions for further tests or assessments that we'll send on to your GP. And so you may be contacted by your GP afterwards. The Targeted Lung Health Check programme is lung cancer screening. When people have an early lung cancer, they usually have no symptoms, and that makes it really hard to find. So within this programme, what we're trying to do is look for people who have early lung cancer who don't have any symptoms. And one of the really big successes in this programme has been that so far, most of the lung cancers we found have been early stage. And that means that most of those people have gone on to have treatment that's cured them of the lung cancer. And that's fantastic. So when we invite you for a targeted lung health check, we really want you to come along and have it, because we think it may be something that really helps you, and it might even save your life.